A very good afternoon, dear viewers. You're watching News 9 Facebook Live with me, Adarsh Vepachedu. At the very outset, I hope you're all doing okay and preferably at home, even if it is working from home. But yes, it is Unlock 1.0 and the number of COVID-19 cases are seeing a huge spike. Now, the reason why I took this opportunity and thought that I must interact with you all is because I must let you know that if you are in Bengaluru at this point in time, you're probably in one of the safest cities across the country. Now, I say this because of the number of cases in Bengaluru as opposed to how several other metropolitan cities across the country are faring against the COVID-19 pandemic. So in this brief interaction, I'd like to tell you folks as to what's been working for Bengaluru and why is it that other metropolitan cities in the country must look to Bengaluru to adopt some of the ways in which we right here in Karnataka are dealing with the COVID-19 pandemic. Now, I say this because of the way the numbers are panning out at this point in time. In fact, as per the latest inputs, if we were to take a look at the numbers across some of the major metropolitan cities versus the COVID-19 numbers in Bengaluru, it will give you a sort of an idea as to where Bengaluru stands and how safe a city Bengaluru is when it comes to COVID-19. Now, when it comes to Mumbai, it has in excess of 60,000 positive cases, 60,228 to be precise, and 3,167 deaths. So in excess of 60,000 cases, in excess of 3,000 deaths coming in from Mumbai. When you look at Delhi, you have cases in excess of 44,000 and deaths in excess of 1,800. So 44,000 plus cases in Delhi, 1,800 plus deaths in Delhi. And when it comes to Chennai, again, one of the worst affected cities in the country, you have 34,000 plus COVID-19 cases from Chennai and in excess of 400 deaths. So all of the cities have a number of cases in 5 digits, and when it comes to the number of deaths, 4 digit. But cut to Bengaluru, we're talking about just 827 cases and 43 deaths. That's all it is when it comes to Bengaluru as opposed to other metropolitan cities. In front of 44,000, 60,000, 34,000 cases, Bengaluru has 827 positive cases of coronavirus. And in front of deaths, like 3,167 from Mumbai, 1,837 from Delhi, and 422 deaths from Chennai. As opposed to all of that, you have 43 deaths coming in from Bengaluru. So what is it? What is the strategy that Bengaluru has applied? How has the COVID war room functioned in the city? And what seems to be the key for really keeping a tight check on the number of COVID-19 cases in Bengaluru? Well, it is simply in a few words, it's all about the continuous practice of quarantining positive cases and identifying the primary and secondary contacts. It's all about aggressive testing that Bengaluru has, in a sense, adopted. And when it comes to the testing of primary and secondary contacts, the aim on ground is to ensure that the testing for primary and secondary contacts is done in a span of just 24 hours. Now, this time span of just 24 hours for testing of primary and secondary contacts is something that most other metropolitan cities across the country are struggling to maintain. So that is point number one. That is key number one as to why Bengaluru has put a check on the number of COVID-19 cases. It is quick testing of primary and secondary contacts of COVID-19 patients and subsequent quarantining of these very people that has kept a check and has kept a tight noose on the number of COVID-19 cases. Now, another important point that we must look at is an analysis that was done by the Indian Council of Medical Research that clearly showed as to between the period of January 22nd and April 30th, Karnataka in fact tested 93 contacts for every COVID-19 patient. 93 contacts were tested for every one COVID-19 patient as opposed to just 20, which is the national average. So as per the national average, for every COVID-19 patient, only 20 contacts are tested. But here in Karnataka, here in Bengaluru to be precise, you have as much as five-fold 5 times the number of tests that are conducted on contacts to ensure that they haven't caught the virus. So that has ensured that the authorities on ground are able to identify and subsequently quarantine, isolate these contacts in case if they may have tested positive for COVID-19. So that's again one more key strategy, if we were to call it, and that is extensive testing of all the contacts of COVID-19 patients, which has really worked in Karnataka's favor, precisely Bengaluru's favor, so to speak. And when it comes to technology also, Bengaluru is the IT hub, so you would expect technology to play its part in the battle against COVID-19. So right here in Bengaluru, you have a situation where as many as half a dozen applications, mobile applications, have been launched by the war room, by the government, and by the folks, by the authorities on ground in Bengaluru to ensure that the number of COVID-19 cases are kept on a tight leash, and the movement of the COVID-19 patients and the people as such in containment zones is properly monitored and checked from time to time. So dependence on applications, in fact taking the help of technology to fight COVID-19 is something that Bengaluru has been doing from the beginning, and it is certainly something that other cities can help. Now, what also helped was that in the early stages of the spread of the virus and during the lockdown period itself, to a few containment zones, and the authorities on ground were quick to ensure that these few containment zones in the city are identified. We are talking about 3 of the containment zones: Shivajinagar, Hongasandra, and Padrayanapura. In the beginning, it was these three hotspots where a lot of cases emerged. So this was identified very quickly, and there was subsequent action taken on ground to ensure that these cases do not further spread and eventually spiral out of control. For example, if you take a look at how Chennai has dealt with it, coming back to Bengaluru for a second before we go to Chennai, the moment you had the lockdown coming into place, Bengaluru went ahead and closed down all of the major markets, the vegetable stores, the shops as such, which has also again restricted the number of COVID-19 cases. I say this because in a city like Chennai, we all know as to how at the Coimbatore market, it's a cluster case, and you have COVID-19 cases completely on the rise. It's literally hitting the highest peak on a daily basis. This is the case in Chennai because the Coimbatore vegetable market, which happens to be one of the biggest vegetable markets in Chennai, was not shut down in a timely manner. It was only after the virus had reached the market that the officials on ground in Chennai closed down the market. But here in Bengaluru, on the flip side, we did not wait for something like that to happen. The authorities on ground went ahead, aggressively ensured that all these big markets where a lot of people can accumulate are shut down at the earliest. So that also ensured that the number of cases do not really spiral out of control. But yes, when it comes to the unlock 1.0 coming into effect, that has taken its toll on Bengaluru as a city itself, because the number of COVID-19 cases have, of course, increased. So, retrospective, if we were to look back, between the period of March 8th to the 31st of May, there were only about 358 cases and 10 deaths that were recorded in Bengaluru. But June 1st to June 17th, there were 469 cases and 33 deaths. So there's that little spike, and June 1st to June 17th is, of course, the period where you had the unlock 1.0 coming into effect. So that clearly showed when it comes to the numbers of the COVID-19 cases coming in. So that's what we're looking at. These are a few things that Bengaluru and the authorities on ground have kept in mind to ensure that things do not really go out of hand, go out of control. And that is the reason why you have a situation where every other metropolitan city across the country is faring badly against COVID-19. The numbers are simply skyrocketing and reaching a daily highest spike on an everyday basis. On the other hand, Bengaluru, because of those few key decisions, few key strategies that were implemented at the right time, you have a situation where Bengaluru, without any iota of doubt, happens to be the safest metropolitan city in the country at this point in time. So yes, those of you in Bengaluru right now can in a sense heave a sigh of relief, at least when we compare Bengaluru with other metropolitan cities, and that is exactly what I thought I should let you know, that there is certainly a matter of relief, and also in a sense a matter of pride in the way in which we have dealt with COVID-19 compared to most of the metropolitan cities across the country. So yes, that's been my brief interaction, a few key pointers that I came across as to what really sets Bengaluru apart compared to other cities in the fight against COVID-19. So yes, if you've liked this information, do not forget to share this clip. You will be able to find it on Facebook and YouTube as well. Make sure you know, you let your friends know as to what Bengaluru has done right and what other cities can definitely learn from the Silicon Valley of India. Many thanks for joining me on this brief interaction. I'll be back once again very soon. This is Adarsh Vepachedu signing off.